Can a cannula be inserted too high for dermal filler treatment? Diagnosed with nerve damage due to bad injection technique. Got 0.5 cc Juvederm Voluma 3 months ago. The injector inserted cannula in one area in each cheek. She really struggled to get product in and hurt my left cheek. The area inflamed, sore and discomfort for first 4 weeks, then constant dull pain with intense stabbing pain, tingling, and crawling feeling. Diagnosed with infraorbital nerve damage. My second opinion aesthetic surgeon said the cannula looked like it was inserted too high. Could this be true? Insertion point still visible in picture.
Thank you for your question. It's been about 3 months since you had half a cc of Juvederm placed in the infraorbital cheek area, and you're asking, can a cannula be placed too high? And based on a series of a description that you stated was that in the first 4 weeks you had stabbing pain and swelling and inflammation, and then you also went for a second opinion, and the doctor said that you had some infraorbital nerve damage, and that your conclusion at this point is that there was infraorbital nerve damage that's permanent. So I think that we should kind of dissect out the details of this situation to understand more about what may or may not have happened and what to anticipate. You also submitted a photo showing where the entry point was. So just to give you a little bit about my background, I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery. I'm also a fellowship-trained oculofacial plastic and reconstructive surgeon. This is a specialty of ophthalmology or eye surgery where we work extensively with the eyelids, the orbit, and lacrimal system. A significant part of my career has been in treating orbital disease, orbital tumors, and orbital trauma. So I can speak from a lot of experience and also give you a little context of what you may have experienced and what to anticipate. So just looking at the area that the cannula was placed, I think that of course, the intention of your doctor was to avoid the challenges met with using a needle, which could cause bleeding or puncture of parts of the anatomy in that area. To avoid that, they used a cannula, which is a blunt-tipped cannula. Blunt tip, in terms of concept, is meant to work its way through tissue and in a way where it does not pierce a vessel, and it doesn't. The structures basically roll around it. That's the concept. Now, it still means that it's still important to understand tissue planes, because just because you have a blunt tip cannula doesn't mean that you also will meet a lot of resistance. And it sounds like what you're describing, that your doctor was struggling. It might have been that your doctor was trying to get to a particular point, may have applied a lot of force, and then overshot. Again, not being there, not knowing the details, I can't say that definitively. Nonetheless, there is a particular area under the eye where there is the infraorbital nerve bundle or neurovascular bundle comes out. And this is an area where the nerves that go to the cheek, to the lip, to the under eye area, the infraorbital nerve, or the second division of the trigeminal nerve. Now, to determine that there is long-term damage is a little bit difficult, because the trauma may have caused some inflammation, which is what seems to be described. However, trauma can often take 6 months to a year to fully resolve. And to give you a little bit of context in how that this all fits in, is that the infraorbital nerve is very often traumatized in facial fractures, in various blunt trauma injuries. It is commonly injected with local anesthesia, the space around the infraorbital nerve, or or at times at the infraorbital canal, or in that space with a needle, and it's routinely performed by dentists regularly to create numbness of the teeth intentionally. So sharp instruments are not, it's not uncommon, or sharp needles are placed in this area, and long-term problems tend not to occur. So I think that there is no question that there was some trauma, and it could have been localized bleeding or localized irritation or swelling that is responsible for what you've experienced. But since it was a blunt instrument, it seems unlikely that any piercing of the nerve or long-term permanent numbness is likely. And the volume of filler is 0.5 cc's. So, and which is, in the scope of things, is not a lot. I think that one of the strategies that might be entertained is to actually dissolve the filler, to see if maybe the pressure from the filler could also be responsible for some of these symptoms. And so that's something to consider. Hyaluronidase is basically an enzyme that we often use to help patients who have come to us in consultation because they have hyaluronic acid filler, whether it's Restylane or Juvederm or Voluma, in a place that they don't want it, and we are able to dissolve it. That being said, there is a lot of technique to placement of fillers. We actually do a procedure called the Y-lift, which is to augment the cheek area, and we actually don't place the cannula. We do use blunt cannulas, but we place it in a strategic way to avoid those particularly sensitive areas. But that doesn't mean that I don't do injectables in this area. I do place filler in this area, right near the space. In that little area of the cheek, or the submalar space, there are lots of nerves and lots of vessels, and it's just a matter of method to try to get the material in the right place and try to get it so that patients don't have these types of experiences. Nonetheless, I think that you may want additional opinions, maybe from an oculoplastic or orbital specialist. You may want to get some an imaging studies, such as an MRI, to look at this area. Or you just may want to just wait it out, and it might just resolve on its own. So, although you went to an aesthetic doctor, you may want to go to a specialist, as I described, like an orbital specialist, to just try to make sense out of what's going on, and then take it from there. Like I said, there are options to maybe dissolve the material. You may need some anti-inflammatories. You might be able to mitigate some of the ongoing inflammation and issues that, if you are still having these symptoms comparable to what you had initially. Again, since nobody except your doctor and you were there at the time of the procedure, it's hard to really predict or to describe exactly what could have happened at the time of your procedure. But it's important to understand that the neurovascular bundle, the infraorbital nerve, it can take a lot of trauma. I have seen patients who have been who have been shot, who have been hit with bats, or who have been in terrible motor vehicle accidents, who had profound issues with the infraorbital nerve, and it healed. So it just means that it can be tough. And even when there's a operative procedure such as orbital decompression, the nerve can take a lot and still be fine. So it's a matter of now of just getting the right information from the right source and the guidance that you need. So I hope that was helpful. I wish you the best of luck. Thank you for your question.